Hello everyone, my name is Ryan Hess. I'm an orthopedic surgeon with Twin Cities Orthopedics. I specialize in sports medicine, and today we're going to talk about something I see a lot of in clinic, which is arm pain in baseball and softball players. So one of the most challenging things I think for athletes and parents alike is that it can be really hard to separate normal soreness associated with throwing from pain and when should they be concerned about that. This can be pain from the neck or shoulder blade area, it can be into the shoulder, arm, or even into the elbow. Doesn't seem to matter what position, it can happen in players that play any position. And I tend to see it more early in the season, in the ramp-up period, and I think it's because they try to do too much too quickly, and I think that this can lead to pain if it's done too quickly. The good news is that this is something that I see a lot, and the vast majority of these athletes are going to get better with a few simple things. Things like rest from throwing, ice, and some occasional anti-inflammatory medications. Most of the time, if you have pain when you return to throwing, that's going to be a red flag. If you get better for a period of time and then later in the season it starts to hurt again, that's also something that's concerning. Also, if you're throwing and you hear a pop or a snap or have a big jump in your pain, that's something we should be concerned about as well. So we'll want to test your different range of motion of your shoulder, of your elbow, and that will help me identify any concerning things there. It's interesting in throwers, most people are going to have a little bit different range of motion normally in their shoulder. And you can see in me, I was a thrower when I was young. And if you look at my right arm, which is my throwing arm, I can rotate that arm a little bit more than my other arm. And that's normal in throwers. There can be subtle differences in range of motion that we have to try to find. So after we've completed a good exam, then the next step might be x-rays. And you can see here on the inside part of the elbow, which is right in here, in this area, that there's a small line there, and that's actually the growth plate on the inside part of the elbow. And most of the time it looks just like this. This would be a normal x-ray. In some players who have an injury there, you can actually get this problem, which is where the bone pulls away from the growth plate. And that's an injury that sometimes will require surgery in some instances. If your pain is more in the shoulder area, we might get some shoulder x-rays. And here's looking at a normal shoulder x-ray. This person has open growth plates as well, and you can see this line right here is the growth plate at the top of the arm bone or humerus. Sometimes if you throw a lot and have an injury there, what you'll see is this, which is widening of this growth plate. And we call this little leaguer shoulder, or some widening of the growth plate there that can cause pain. Make sure you're communicating well with your athlete and with their coaches to make sure that they're following all the appropriate guidelines and those sorts of things. Pay attention to your athlete, know which positions they're playing, make sure that you're talking with them about if their arm is hurting or things like that. One of the most common questions I get about arm injuries is what can I do to prevent them? And I think that's actually probably the thing that we want to do most, is do what we can to avoid having these problems in the first place. Make sure that you do appropriate warm-up exercises. And also, especially at the beginning of the season, we want to make sure that you're ramping up your throwing gradually. As far as pitching goes, we want to make sure that you're taking a few months off from throwing every year. But if you do these things and the arm is still bothering you, there's still concerns, obviously get a hold of us and let us know that you need our help.